cover the removable appliance in two parts. In the part 1, we will be studying what are the advantages, disadvantages. We will overview these appliances. Especially my focus would be on the indication and patient selection, how you would be selecting patients for the removable appliances. What are the contraindications, components, and the mode of action of the appliance. We have two types of the orthodontic appliances. One is the fixed and the other one are the removable one. So what are the fixed appliances? The basic concept and the definition criteria for defining the fixed appliances are basically those appliances are called the fixed appliances which are attached with the dentition or in the oral cavity, and the criteria is this, that the patient or a subject cannot remove the appliances out of the oral cavity. These are called the fixed appliances. However, the removable are those kind of appliances which the patient can remove from their oral cavity. So the basic criteria of the fixed or a removable is the patient's, if the patient can remove, we call it as a removable. So the word removable is derived from the word remove. So what are the removable appliance? Which removable. So the appliances which can be removed by the patient are called the removable appliances. The point is this, that all the fixed appliances has the issue of the visibility, because the patient can remove the appliance at any given time at any social event. That's why they are much more acceptable in those patients in which the aesthetics are very concerned, and they do not want that they are getting any kind of treatment, orthodontic treatment. For example, if you have any celebrity and they do not want the treatment is going on and they are getting correction of malalignment of the teeth. So these removable appliances are the appliances of the choice, because they can be removed at the time of the shooting and nobody would be able to know. So in the current practice, this clear aligner therapy and the clear aligner also fall within the domain of the removable appliances, because the patient can remove it. In a similar way, orthopedic appliances like headgear, because the patient can remove it, that's why they fall within the definition of the removable appliance. These are the functional appliances which change the position of the jaw, because they can be removed from the oral cavity by the patient. That's why it's considered as the removable appliance. However, our focus in the classical concept, I said in the classical concept, the removable appliances are these kind of the typical appliances having the base plate, label bows, which you make during the quota of your final year. These are the classical appliances. Today we are going to study about the indications, contraindication, advantages, disadvantages, and different components of these classical removable appliances. So as I said, the definition of the removable appliances is which we can remove from the oral cavity, and these are the classical appliances. So one of the major difference I said in the start is the visibility. Visibility means that the fixed appliances are permanently attached and only the orthodontist or the operating practitioner can remove it. So that's why the oral hygiene is a major, other than the visibility of the appliance and the aesthetics, the oral hygiene is the second most important comparison with reference to the fixed appliances. What happened in the fixed appliances, 2/3 of your tooth structure, you have the natural cleansing going on. आपको पता है ना कि आपके चीक और टंग मूवमेंट्स के साथ जो है वो आपके 2/3 of the teeth automatically साफ हो रहे होते हैं. The gingival 1/3 are the main issue for keeping the good oral hygiene. But what actually happens when you apply fixed appliances, that the natural cleansing of the dentition by the cheeks and by the impaired. Got it? जो नेचुरल क्लिनजिंग थी आपकी चीक मूवमेंट्स के साथ और टंग मूवमेंट के साथ, वो अप्लाइंसेस के, that's why you you need to maintain a very good oral hygiene. That's why you could be having some lesions. These are called the white spot lesion. These occur because of the plaque retention and initiation of the caries around the fixed braces. So, but you would not be having the same kind of the issues in the removable appliances, because the removable appliances are worn for 22 hours, 23 hours, and they are removed when you eat something. Please note it down. When the removable appliances are removed, while eating, you will definitely be asking the patient, and while cleaning teeth. It's mean that the removable appliances should be in place when you are sleeping. Is this clear? I said when the removable appliances are removed when you are eating anything and when you are cleaning the teeth. So, as the fixed appliances are in place when you are having the eating, and the natural cleansing is impaired, that's why you could have the situation like the initiation of the caries around the braces. And just imagine how unaesthetic and how damaging it would be to having the caries around the brackets. And the brackets and the fixed appliances are on the labial surface of the teeth. In the removable appliance, you don't have these kind of the issues. The removable appliances, as I said, are removed when you are practicing the oral hygiene, and you could have you can practice a very nice oral hygiene instructions. So you can very easily practice oral hygiene instructions having the treatment with the removable appliances. And nothing needless to forget that the removable appliances are cleaned as well. You have to maintain the cleanliness of the removable appliances as well. जहाँ आप टीथ की ओरल हाइजीन का ख्याल रखेंगे, वहाँ डेफिनेटली you will be taking care of the oral the aesthetics. You will be taking care of the hygiene of the appliances as well. Another important comparative between the fixed and the removable appliances are the chair time. As you can see in this slide, that the removable appliances are constructed in the laboratory, okay, and in the clinic during the chair time, what is important, you just make the adjustment of the appliances and they are not taking too much time. Your scheduled appointment would be around 10 minutes approximately, because you will be looking the appliances, you will see the appliance, you will adjust the appliance, and this would not be time taking. For example, now many of you have a clear idea about the labial bows, Adam clasp, slight trimming of the acrylic may be required during the appliance. You will reassure the patient, and motivate the patient regarding the oral hygiene practices. So, but my mean to say that my point is this: with having the removable appliances, your chair time would be dramatically reduced, and you can see and you can appoint many patients during these during the 3 or 4 hours of your clinical practice as compared to the fixed appliances. With the fixed appliances, the issue is this, that you have to have a long chair time is required for the adjustment, for removing the wire, for putting the new wire, and maybe you may be needing some wire bending. So the removable appliances are much less chair time taking. So in the current practice, the clear aligner are also included as the removable appliance, but these appliances are even superior than the classical one, because their chair time is dramatically reduced as compared to the classical one. Classical method, then you have to make some adjustment of the labial bows and the Adam clasp. Here, you don't have to do for the adjustment of the clasp, and you just put the new aligner, and the chair time is dramatically reduced. Another reason, another comparative between the fixed and the removable is the lack of control in the removable appliances. You are not having a very refined control, and these removable appliances may be more cumbersome and more complicated if you try to execute a difficult kind of tooth movement because of the lack of the couple. Lack of the couple, what I said, in the couple you are having two forces equal in magnitude opposite direction. So in the removable appliance, your attempt to achieve the couple movement or a 2-point attachment is really difficult. Okay, so when you try to give a 2-point attachment, so 2-point attachment is something really problematic in the removable appliances, and this is a piece of cake for the fixed appliances. For the undergraduate level, what you need to memorize is this, that a very simple kind of tooth movement is executed with the help of the removable appliances, and for the complicated and a very fine detail of the, you have to go for the fixed appliances. Moving on, the advantages, just have a quick review. हमने काफ़ी चीज़ें डिस्कस कर ली हुई हैं. The advantages of the removable appliance, they are fabricated in the laboratory and adjusted extraorally, and thus the dentist chair time is dramatically reduced. Second most advantage is this, that they are more acceptable in the adult patient, because in the adult patient, if they do not want that they are getting orthodontic treatment or any kind of treatment, these appliances can be removed from the oral cavity in a socially important event. Okay, so third, what I already discussed in detail, as they can be removed from the oral cavity for the cleaning purposes, so as compared to the fixed appliances, with these appliances we can have a good oral hygiene practices, and the possibility of the complications by the fixed appliances, as we normally see in terms of the white spot lesion, which is basically the initiation of the caries around the bracket. We don't see these kind of the complication having the removable appliance. So these are the main key advantages. What are these? Their chair time is dramatically reduced. The patient is more acceptable with the, because in the current practice of orthodontic, many patients coming to us, they are straight away asking for the aligners and the removable appliances because of the issue of the visibility. They can be removed, so that's why the oral hygiene is dramatically different. And other very important advantage of the removable appliance is this, that palate is very easily usable in the removable appliances. How? In the fixed appliances, all the teeth are attached with all the brackets, and the appliances is attached with the dentition. Okay, so but in the removable appliance, you have to have the base plate. Base plate is something which is acrylic part, and this acrylic part is embedding all the active components mean labial bow, and all the active and the retentive components are embedded and supported with the help of the base plate. So this base plate, as this base plate is directly, what is base plate? This is basically the base plate, which you can see over here. ये जो acrylic का part है जिसके अंदर label bow और Adam class embed हुए हैं, this is base plate. And as you can see that this base plate is directly in contact with the palate. So palate पर touch होने की वजह से आप जो है वो बहुत high anchorage attain कर सकते हैं. What we were discussing, हम discuss कर रहे थे advantages of the removable appliance. लैब में फैब्रिकेट होता है, चेयर टाइम कम है, मोर एक्सेप्टेबल फॉर द अडल्ट पेशेंट, सोशली इंपॉर्टेंट में दे कैन बी रिमूव फ्रॉम द ओरल कैविटी. से ओरल हाइजीन जो है वो ज़्यादा अच्छी प्रैक्टिस की जा सकती है. हमने ये कहा चौथी मोस्ट इम्पॉर्टेंट बात कि जी एंकरेज प्रोविजन में हॉरिजॉन्टल और वर्टिकल मींस के सैजिटल प्लेन और वर्टिकल प्लेन दोनों प्लेन्स में जो बेस प्लेट की वजह से बेस प्लेट जो है वो बहुत वाइडर एरिया में, फिक्स अप्लाइंसेस में भी हम पैलेट से एंकरेज ले सकते हैं विद द हेल्प ऑफ द डेंस अप्लाइंसेस, लेकिन जो साइज ऑफ द बेस प्लेट जो डायरेक्टली इन कांटेक्ट है पैलेट के साथ, दैट इज़ वेरी मच greater as compared to the dense appliance, so you can very easily achieve a good anchorage with the help of the removable appliance. Then the important point is that overbite reduction. What is meant by overbite control? What is overbite? ये भी आपने शायद नहीं पढ़ा हुआ. Is increased overlap of the upper and the lower dentition. That is called the increased overbite. Okay. So what a removable appliance can do? If we fabricate the removable appliance in a way that the base plate is in contact with the palate, with the lower teeth, and here is the base plate coming on. Normally यहाँ पे अगर gum start हो रहा है तो वो base plate इधर end हो जाती है. If this base plate is so extended anteriorly that the lower teeth instead of going up to here, जैसे कि मैंने draw किया था, and you are having a deep overbite. If the lower teeth are touching over here, so you would be having some gap between the upper and lower teeth. Having the removable appliance in place, the upper and the lower teeth would be separated. What I mean to say, after the wearing of this appliance, when you wear this appliance, this acrylic or the plastic component is touching to the lower incisor. This plastic component is touching to the lower incisors, and this has created some gap between the upper and the lower teeth. Is this point clear? What we are talking, that the removable appliances are an amazing kind of appliances if we are dealing the childs in which the vertical growth of the ramus is going on, and we all know that when the teeth are separated, they start supra-erupting in order to reach to the occlusal plane. We already studied about the juvenile occlusal equilibrium. हमने juvenile occlusal equilibrium पढ़ा था ना. वो क्या था juvenile occlusal equilibrium? वो ये था कि आपका जो ramus है वो vertically grow करना शुरू कर दिया. When the ramus has start vertically growing, the teeth are separated from each other. So in order to maintain the contact of the upper and lower teeth, the teeth has starting supra-erupting, और वो अरप्ट करके अक्लूजन में आ गए. ये आपने अडल्ट अक्लूजल इक्विलिब्रियम में भी देखा होगा कि जो अपोजिंग टूथ एक्सफोलिएट कर गया तो जो रिमेनिंग टीथ है वो सुप्रा अरप्ट करना शुरू कर देता है. तो रिमूवेबल अप्लायंसेस ओवरबाइट में कैसे अच्छे तरीके से ट्रीट कर सकती हैं कि फॉर एग्जांपल इनिशियली द लोअर इंसाइजेस वर समहाउ लाइक दिस. You are having traumatic bite or very deep overbite, but by giving the removable appliances, this removable appliance is touching to the lower incisors at the optimum overbite. That's why this has created some gap between the upper and lower teeth, and what would happen as a consequence, the teeth would start supra-erupting. As a practicing GP, आप UHS के एग्ज़ाम के 1 मिनट के लिए साइड पे भी रखते हैं, और as a general dentist practitioner, this is a very important clinically relevant information that what are the classical conditions which you can achieve with the removable appliances. अभी हम advantage disadvantage के वो उसके बाद पे जाते हैं. So what I said कि if you are having a patient of the deep bite, you can very easily achieve the eruption of the molars. Somehow this will, as this plastic component is touching to the lower incisors, this can cause some of the intrusion of the lower incisor as well. ठीक है. अच्छा, another reason is this, that the removable appliances can act on the block of the teeth. ये मैडम ने आपको डॉक्टर नीला ने पढ़ाया भी होगा कि a removable appliance is labeled is touching to the all of the incisors. So at the same time, the block of the teeth are being under treatment, and they can transmit forces to the block of the teeth as well. अच्छा, दूसरी बात ये कि जो ग्रोथ गाइडेंस जो है, हमने कहा कि जो ऑल द फंक्शनल अप्लायंसेस फॉल्स अंडर द डेफिनेशन ऑफ द रिमूवेबल अप्लायंसेस, तो ग्रोथ गाइडेंस भी कर सकता है. अ वेरी इंपॉर्टेंट पॉइंट इज दिस, दैट दे आर लेस एक्सपेंसिव एंड इजीली रिपेयरेबल. लेस एक्सपेंसिव मीन्स दिस, देखो जो नेशनल हेल्थ सर्विसेज हैं यूके में और द गवर्नमेंट सेक्टर्स हैं, जहाँ पर एक फिक्स अप्लायंसेस कि ना सिर्फ कॉस्ट को बियर करना बहुत मुश्किल है, बल्कि उसका चेयर टाइम इज़ ऑल्सो द पार्ट ऑफ द कॉस्ट एज वेल. अगर आप एक क्लिनिक पे फिक्स अप्लायंसेस के पूरे दिन में सिर्फ 10 पेशेंट देख सकते हैं, तो उसकी चेयर टाइम कॉस्ट ज़्यादा होगी एज कम्पेयर इफ़ यू कैन सी 50 पेशेंट्स. सो द रिमूवेबल अप्लायंसेस आर लेस एक्सपेंसिव फॉर 2 रीजन्स. एक तो उसकी कंस्ट्रक्शन और उसके बनाने में जो मटेरियल यूज़ हो रहा है, द मटेरियल विच इज़ बीइंग यूज्ड एंड द लैब charges are very cheaper as compared to the fixed appliances. Secondly, I had a lot of emphasis on the chair time because expense is directly related to the chair time as well, because if you can see a greater number of the patient during the same hours of the practice, so that's where the removable appliances are very economical in the sense. And if they are broken, you're already aware of this, that you can have the repair of the dentures. So if they are broken, they have some problem, that these can be repair as well. ये आपका जो है वो labial surface of the teeth है, ठीक है. So when a round wire is touching on the labial surface of the anterior teeth, what you can see, there would be a single point of contact, क्योंकि ये आपकी सरफेस है और ये राउंड वायर है, ठीक है. तो ये सिंगल पॉइंट ऑफ कांटेक्ट आ रहा है. तो सिंगल पॉइंट ऑफ कांटेक्ट जो है, एज आई सेड एंड वी डिस्कस्ड इन द अर्लियर चैप्टर, कैन नॉट प्रोड्यूस अ कपल. ये बात समझ में आई आपको? अ सिंगल पॉइंट ऑफ कांटेक्ट जो है वो कपल प्रोड्यूस नहीं कर सकता, वो एक सिंगल पॉइंट फोर्स कर रहा है. दैट्स वाई द लेबियल बो can produce only a tipping kind of tooth movement. The labial bow, which is the classically the active part of the removable appliances, can produce only the tipping kind of tooth movement. So now moving on, we discuss different disadvantages of the removable appliances. One of the key reason जो अभी हमने डिस्कस किया कि जो है वो सोशली इंपॉर्टेंट इवेंट के ऊपर जो है, जो पेशेंट कैन रिमूव द अप्लायंसेस, दिस कैन बिकम अ डिसएडवांटेज एज वेल, because the treatment is now solely dependent on the compliance of the patient. Now treatment is totally dependent on the compliance. The removable appliance will function and perform if the patient is wearing the appliance. If the patient is not wearing the appliance, no matter what, how nicely it is constructed, how nicely it is planned, how experienced or the good is the orthodontist, कुछ भी काम नहीं करेगा. The thing that will work out is that the patient is responsible for the treatment, because major responsibility of the treatment is on the patient. The reason being the compliance of the patient is extremely needed in the removable appliances, because if the patient would wear the appliance, only the treatment would be successful. If the patient is not wearing, no matter how nicely it is constructed, how experienced is the orthodontist, nothing will work out. Secondly, I said here in the start that in the removable appliances, only a single point is untouched, and the major movement that you can achieve is that the tipping movement. Tipping movement is the key and the major kind of the movement that can be achievable with the removable appliances. In a simple word, the complex bodily movement, torquing movement, a very nice intrusion, because for the intrusion extrusion, yes, we can achieve these kind of movement with the removable appliance, but the fine details and the fine control that is classically attained with the removable appliance, with the fixed appliances, is not practically possible with the removable appliances. The reason being, the complex tooth movement is not possible with the removable appliances. Okay, the appliances can be left out. If they are not patient is wearing, only tipping movements are possible. They definitely affect the speech, क्योंकि आपकी जो movement है जो टंग की, वो लिंगवो एल्वियोलर या लिंगवो डेंटल, सो उसी जगह के ऊपर जो है वो अगर आपकी बेस प्लेट या रिमूवेबल अप्लायंस आ रही है, सो दैट इज डायरेक्टली अफेक्टिंग योर स्पीच. हाउ दे आर अफेक्टिंग द स्पीच, कि जहाँ पे टंग ने, मेरी वीडियो पे क्लिक कीजिएगा ताकि आपको शो हो सके. जब भी मैं व्हाइट बोर्ड पे आऊँ ना, फ़ौरन आपने मेरी वीडियो पे क्लिक करना. इस जगह पे आके आपने टंग ने टच करके लिंगुओ एल्वियोलर साउंड्स प्रोड्यूस करनी थी। दिस इज द एल्वियोलस और लिंगुओ एल्वियोलर बोन। इस जगह के ऊपर अगर आपका एक्रेलिक आ गया तो जैसे ही आपने अप्लायंस फिट की जिसके ऊपर पैलेटल कवरेज थी और वो पैलेटल कवरेज या एंटीरियरली बहुत ज़्यादा एक्सटेंडेड है या उसकी थिकनेस बहुत ज़्यादा है, तो क्या होगा, बिकॉज ऑफ द इंक्रीज थिकनेस एंड बिकॉज ऑफ द एंटीरियर एक्सटेंशन द टंग इज टचिंग on these acrylic part and you would be having difficulty in the speech in the start of the treatment. But you know you have the brain center जिसमें कि आप आहिस्ता आहिस्ता अगर उसकी if you keep on practicing the try to speech with the good quality this is achievable कि आप एक्रेलिक प्लेट के साथ बोलना शुरू कर दें। सो दैट्स वाई जिन पेशेंट को हम फंक्शनल अप्लायंस देते हैं कहते हैं कि जी 22-23 घंटे पहने और रिमूव अप्लायंस दे के 22-23 घंटे हम उनसे एक्सपेक्ट कर रहे होते हैं। उसमें यह है कि आहिस्ता आहिस्ता हैविंग दी acrylic on the palate, the patient get used to and they achieve a normal kind of a speech having the base plate in. Then they start difficulty in speech without the appliance because their neuromuscular programming and the speech center are trained according to the palate. So they can speech in the start of the treatment. Later on जो है वो उसमें जो है टेक्नीशियन के ऊपर बहुत ज़्यादा डिपेंड कर रहा है। इंटरमैक्सिलरी ट्रैक्शन इज़ नॉट पॉसिबल। ये अब ना क्लास 2 में डॉक्टर फिर शायद आपको पढ़ाएंगे कि यू कैन यूज़ क्लास 2 इलास्टिक। सो वन ऑफ द डिसएडवांटेज ऑफ द removable appliance is this, that intermaxillary traction you cannot put something elastics intermaxillary traction का मैं idea दे दूँ कि one elastic attachment is in the maxilla, the other is in the mandible and the elastic is running between the arches. Having the removable appliances in place, the intermaxillary यानी between the upper and the lower jaw traction or the elastics are not possible. You just hold this point. This needs some more elaboration. मैं अभी कोई picture आती है तो मैं अभी आपको दिखाता हूँ. They are inefficient for multiple tooth movement क्योंकि in simple crux, if I just ask you to memorize only one point from this lecture, एक वाहिद बात जो इस लेक्चर की याद रखने वाली है, अगर आप याद रखना चाहते हैं, that point is this, that the removable appliances cannot produce a fine detail of tooth movement. They are mainly for the tipping tooth movement. This is the most important point for this lecture. So they are inefficient for the multiple tooth movement. Lower arch में removable appliance इतनी successful नहीं है, the classical removable appliance. Removable appliance lower में इसलिए भी इतनी अच्छी नहीं क्योंकि tongue बिल्कुल adjacent है, tongue is constantly, the tongue space is encroached with the removable appliance. Yes, this is a very important reason. But the main point in the lower arch is that the lower teeth are normally, they are inclined like this. ये नॉर्मल इतना तो मैंने बहुत एग्जैजरेट कर दिया. And you have an undercut by the teeth and undercut by the bone. आप फील करके देखें, हर बच्चा, हर स्टूडेंट अपना फील करके देखे अपने लोअर पोस्टीरियर एरिया को. कैन यू अप्रिशिएट द undercut by the bone and by the teeth? Do it and feel it. आप फील करके देखें कि जो teeth are lingually inclined because the lower posterior teeth are lingually inclined, तो उनके नीचे बिल्कुल एक undercut create हो रहा है. अब removable appliance को आपने चढ़ाना भी हो, उतारना भी हो, तो undercut तो आपको रिलीव करना पड़ेगा. undercut आपने रिलीव किया तो एक गैप आ जाएगा जो unavoidable गैप है. ठीक है, एक अनअवॉइडेबल गैप है बिटवीन द टीथ एंड बिटवीन द एक्रेलिक. ये बात समझ में आई आपको? ठीक है, कि बिकॉज योर लोअर पोस्टीरियर टीथ आर लिंगुअली इंक्लाइंड, सो यू हैव अ डीप अंडरकट between your teeth and between the bony undercut you are present. Because of these undercut you have to relieve the acrylic. वो undercut आपने block करने. After the blocking the undercut, they are very difficult for the patient to achieve and to hold the removable appliances क्योंकि वो gap इसके बीच में आया हुआ है. Fine जो टचिंग थी जैसे कि अपर में था, अपर में पैलेट के साथ डायरेक्ट इन कांटेक्ट में था, यहाँ आप सिर्फ लोअर पार्ट पे इन कांटेक्ट पे है और वो भी थिन म्यूकोजा। देखो अपर का तो म्यूकोजा भी कितना हार्ड और क्रेटिनाइज्ड म्यूकोजा था, तो यहाँ अनक्रेटिनाइज्ड म्यूकोजा है और वो प्रॉपरली इन टच भी नहीं है। So less than ideal result are achieved and you see the less precision, जो मैंने बात आपसे बार बार की कि जी you cannot achieve a very fine detail of the tooth movement with this appliance। ये मैं कहना चाह रहा था intermaxillary traction, स्लाइड उसके आगे, कि ये fixed appliances में you can have attachment from the upper arch and from the lower arch। You cannot have these kind of situation in the removable appliances. If you are placing elastics from the upper arch and the lower arch, as we can practice in the fixed appliances, all the upper and lower appliances would be dislodged और वो आपके हाथ में आ जाएंगी and you cannot achieve fine details। So what are the indications? थोड़ा सा आपको आइडिया हो चुका हुआ है जहाँ पर incisors की inclination हमने ठीक करनी है। Why incisors inclination? If the incisors are proclined, if the incisors are proclined, and as I said, the removable appliances are mainly meant for the tipping kind of tooth movement. So if you have proclined incisors and you want to tip them back, you want to decrease the inclination, and you do not want bodily tooth movement, torquing tooth movement, fine detail of tooth movements are not required. So for the proclined incisors, having slight spaces in between so that you do not need struggling for the spaces in order to retract them. So for the incisors proclination, the removable appliances are the appliances, could be the appliances of choice, because the removable appliance can very easily treat the proclined incisors. So if you want to treat one arch, they can be very nicely treat only one arch. For example, you have proclined upper incisors having some mild spaces, so you can give the appliance only in the upper arch. Okay. For the narrow arches, you can have coffin spring, which I tell you in tomorrow's lecture, or kind of a screw that can open the palatal in the mixed dentition especially. So in the narrow arches, if we want to broad the arches, with the help of the screw in between the base plate, you can activate, और the coffin spring जब भी हम कल दिखाते हैं आपको, तो उसके साथ you can achieve the slightly arch expansion. So proclined incisor treatment only in the one arch, or for the arch expansion, the removable appliance can be appliance of choice. As you can expand, so this can very easily treat the unilateral crossbite. वाई यूनिलैटरल, देखो बायलैटरल में भी कर सकता है, लेकिन ये कि बायलैटरल में आपकी रिक्वायरमेंट बहुत ज़्यादा होगी, दोनों साइडों से आपने एक्सपैंड करना है। यूनिलैटरल में ये थोड़ा सा ट्रिकी कॉन्सेप्ट है, ये डॉक्टर सादिया आपको फुल डेप्थ में लेके जाएंगी कि यू कैन हैव अ सिमेट्रिकल कंस्ट्रक्टेड मैक्सिला इन अ यूनिलैटरल क्रॉसबाइट इफ द पेशेंट इज डिफ्लेक्टिंग द मैंडिबल। ये अभी आपको इसको छोड़ दें इस बात को। सिंपल मैसेज ये कि यूनिलैटरल क्रॉसबाइट में आपको लेसर अमाउंट ऑफ द एक्सपेंशन इज रिक्वायर्ड, दैट्स व्हाई you can use the removable appliances in the unilateral crossbite. Single malposition tooth में आप यूज़ कर सकते हैं, सिंगल टूथ के ऊपर जो है यूज़ हो सकता है बहुत easily, ठीक है। जैसे कि एंटीरियर क्रॉसबाइट केस है, यू वांट ओनली दिस सिंगल टूथ करेक्शन, तो उसके लिए आप पूरी अप्लायंस लगाने के बजाय ओनली टिपिंग मूवमेंट इफ द रिक्वायर्ड, देन फॉर द सिंगल malposition tooth you can use it very easily. And for the anterior crossbite correction, इसके हम डेप्थ में जाएंगे। एंटीरियर क्रॉसबाइट करेक्शन, पोस्टीरियर क्रॉसबाइट करेक्शन, ट्रांसवर्स करेक्शन वगैरह में द रिमूवल appliances कैन बी वेरी इजीली यूज्ड, एंड वी ऑलरेडी टॉट इन डेप्थ इन चैप्टर नंबर 5 व्हेन वी स्टडी चैप्टर नंबर 5 दिस removable appliances can be used as a habit breaker appliance. Quickly summarizing the indications, these removable appliances can be used for a simple, mild and a non-complex kind of tooth movement, okay, where you need mainly the tipping kind of tooth movement, okay. So this can be used for the proclined teeth. If the treatment required on the upper arch, you can go for the expansion, okay. In the expansion, the base plate is in contact with the palate. You want to expand the palate, so you open the screw and the base plate is opening, that is directly in contact with the palatal tissue. So this can be nicely treated for the crossbite correction, especially anterior crossbite where the tipping movement is required. it is not usable in all kind of crossbite. It is usable in the crossbite situation where the very important very common cause of the posteriorly or palatal deflected path of eruption of the upper incisors. So क्या हुआ कि if for the crossbite correction, if the tipping movement is required, so the removable appliances can be used very nicely for the proclination of the teeth. क्या बातें मैंने की नॉन कॉम्प्लेक्स टूथ मूवमेंट जहाँ पे टिपिंग मूवमेंट रिक्वायर्ड है, आर्च एक्सपेंशन के लिए, यूनिलैटरल एक्सपेंशन के लिए या इंटीरियर क्रॉसबाइट के लिए आप यूज़ कर सकते हैं और हैबिट ब्रेकर के लिए यूज़ कर सकते हैं. कॉन्ट्रा इंडिकेशंस क्या हैं? कॉन्ट्रा इंडिकेशन ये है कि जहाँ पर कॉम्प्लेक्स काइंड ऑफ टूथ मूवमेंट रिक्वायर्ड हैं, बॉडी टूथ मूवमेंट, टॉर्किंग, रूट को मूव करना है, क्योंकि दिस इज़ वेरी डिफिकल्ट टू अचीव अ कपल काइंड ऑफ टूथ मूवमेंट with the help of the removable appliances. There is a lot of R&D going on कि हम अलाइनर में कपल कैसे प्रोड्यूस कर लें, बट दिस इज़ द लेटेस्ट एडवांटेज, उसको हम छोड़ देते हैं. जो क्लासिकल कॉन्सेप्ट है जो बुक्स में है वो ये है कि जी 2 point अटैचमेंट और कपल मूवमेंट इज़ वेरी डिफिकल्ट फॉर द removable appliance, so you cannot have a very fine detail and you cannot get a very nice results with the removable appliance. So this is a contraindication where you want to achieve a very fine detail of control of tooth movement. Okay, so contraindications क्या हैं? As you can see on the slide, कि severe skeletal discrepancy, upper and lower arch coordination upper or lower both arches में complex tooth movement required है, severe rotation कि tooth rotated है तो उसके लिए you may be needing 2 point attachment, and for the severe rotation removable appliance is a contraindication. Then I said for the bodily tooth movement they cannot work because they work mainly for the tipping kind of tooth movement. For the severe crowding and for the very denser bone you cannot have the removable appliances. They mainly cause the tipping and you have the center of rotation जिसको हम एक fulcrum का नाम भी दे सकते हैं. We can give and the fulcrum is roughly around in the middle of the root. So for the tipping kind of tooth movement, that's why with having the removable appliances you get mainly the tipping movement around the fulcrum that is in the mid of the root. क्या मटेरियल यूज़ होता है? मटेरियल इज़ बेसिकली क्लासिकली जो है वो स्टेनलेस स्टील और एक्रेलिक है. The wires which you already have practiced in your quotas, you see you have the stainless steel wires, mainly the round wires and the blaze plate. These are mainly the two important components. So they can be classified according to their uses. Classified means that based on their activity they can be active. Active mean that can produce tooth movement. All the removable appliances which has the active component incorporated in the design of the appliance, these are the active appliances. Passive are those which are kind of a retainers. जो टूथ मूवमेंट जैसे ऑर्थोडोंटिक ट्रीटमेंट के बाद हम रिटेनर्स आपको पढ़ाएंगे, तो जो टूथ मूवमेंट को रिटेन करने के लिए अप्लायंसेस यूज़ होंगी उसको हम पैसिव रिमूवेबल अप्लायंस कहेंगे. पैसिव क्यों? कि बिकॉज एज द वर्ड itself is showing, passive mean that they are not conducting any kind of tooth movement. So the removable appliances are considered as active and passive. Active means which has incorporated the active component within the appliance and that can produce tooth movement. They are supposed to create tooth movement or called the active appliances, and the passive means that they are supposed to maintain the tooth position. What I said, maintain the tooth position. They are not supposed to cause and produce any kind of tooth movement. That's why they are called the passive appliances. And all the retainers are like a passive appliances because as the name shows, retainer, to retain the position of teeth on their corrected position. So all this space maintainer भी अब आपको पढ़ाएंगे भी बाद में, तो स्पेस को मेंटेन करने के लिए या रिटेनर्स जो हैं ये पैसिव रिमूवेबल अप्लायंसेस हैं.